ठीक है, थैंक यू। Good evening, students. Good evening, students. Are you able to see me? Good evening, students. Am I audible? So today we'll be looking at some MCQs. Okay, thank you, Shailesh. Now I know that I can see the messages. Earlier on, I was unable to see your messages. So today we'll try to solve some of the MCQs of dental histology. Look at some some MCQs from dental histology, right? So the first MCQ, yes, we'll go to the answer. The core of the hydroxyapatite crystal, right? The cores of the hydroxyapatite crystallites in enamel differ slightly in composition from the periphery being. So first of all, we need to understand what the question wants to ask, right? It is asking what is the feature of the core that differentiates it from the periphery. So options are: it is richer in carbonate and magnesium, it is poorer in carbonate and magnesium, then it is richer in fluoride, and option D is none of the above. And as Palak said, the core is richer in carbonate and magnesium. So the first form hydroxyapatite during in amelogenesis, when the hydroxyapatite is first formed, it is richer in carbonate. Right? It is richer in carbonate and magnesium. And because of this, the newly formed hydroxyapatite, because of its carbonate presence, is often called carbonatoapatite. Right? It is often called carbonatoapatite. And fluoride is present on the surface. Right? It is more on the surface as compared to the core, and therefore option A is the correct answer. Right? Option A is the correct answer. So let's go to the next question. Which of the following best describes the relation of water to hydroxyapatite crystallite in enamel? So we know that in enamel we have inorganic, which is approximately 96%, and then we have water, which is approximately 3%, and organic is only 1%. Right? Organic is only 1%. So what the question is asking, where in the enamel is this water located? Right? Where in the enamel is this water located? So which of the following best describes the relation of water to hydroxyapatite crystallite in enamel? Options are: water lies between crystals and surrounding the organic material. So what it means is, let's say these are the hydroxyapatite crystals. These are the hydroxyapatite crystals, and in between them we have the organic material, that is enamel proteins, right? Amelogenin and non-amelogenins. In non-amelogenins we have ameloblastin, sheathulin, that ameloblastin, enamelin, and tuftil. So surrounding this organic matrix, surrounding this organic material is a layer of water. So surrounding this organic material is a layer of water, right? So that's what the first option is saying. Then second option says that water may be trapped within defects of the crystallite structure. So it may be trapped. Let's say this is a defect in the crystallite structure, and in the defects water may be trapped. Right? So in the defects water may be trapped. Third option says that the water forms a hydration layer coating the crystals. So, according to the third option, there is a coating of water on the surface of this crystal. So, this entire crystal is coated with a layer of water, and that too is the correct option, right? So, in total, all the options are correct. So, all of the above are correct options. So, water lies in these three spaces, right? Water in the enamel lies in these three spaces, and it helps in the movement of ions through the enamel. So, with age, its composition changes, right? Its mineralization increases. When we apply fluoride from the external surface, the fluoride content of the enamel increases. So, how does this fluoride ion travel through the enamel? It travels through these water channels, right? So, ions like fluoride travel through these water channels, right? They travel through these water channels. So, let's go to the next question. Which of the following is primarily responsible for the exceptional hardness of enamel? So, we know that enamel is the hardest tissue, right? Enamel is the hardest tissue. And which of the following options is the primary reason? Options are, it's high in organic content. Option B is hydroxyapatite crystal size, that is, it has the largest sized crystals. We know that the size of the hydroxyapatite in enamel is approximately 75 nanometers into 25 nanometers into 100 nanometers, and it is approximately 300 times the size of the hydroxyapatite crystal of dentine. So, as compared to the crystal of dentine, it is approximately 300 times larger. Option C says the hexagonal rod shape of the crystal. So, it is talking about the shape of the crystal. It is hexagonal in the cross section, and in the longitudinal section, it is again hexagonal, but it appears like a rod, right? And option D says the unique chemical formula of the hydroxyapatite crystal. So, that is common for all the inorganic tissues, right? And option A, that is the high inorganic content. We know that approximately 96% of enamel is inorganic, and that is the primary reason for its hardness, right? So, this is the primary reason for its hardness. Option A, that is its high inorganic content and not its size or its shape or its chemical formula, right? Though we can include both option B and C as other reasons for the high hardness of the enamel. So, had the question been what are the reasons for its hardness, then we could have gone with option D, that is all of the above. इस case में क्या होता? Had the question been instead of primarily which of the following is responsible for the exceptional hardness, and had there been a question all of the above instead of this option D, then we could have gone with option D. अगर इसमें primary word नहीं होता और एक option होता all of the above, then we could have gone with option A, B, C all together, right? So, next is the demarcation between the primary and secondary dentine is called. So, what is the demarcation between primary and secondary dentine called? So, in case of primary dentine, we know that we have long accentuated dentinal tubules, isn't it? Long accentuated dentinal tubules. But the secondary dentine, it is thinner as compared to the primary dentine. Also, their curvature is opposite that of the primary dentine. Their curvature is opposite as compared to the primary dentine. So, you can see their curvature is exactly opposite of the primary dentine, right? So how do we differentiate, or what is the line between the primary or secondary dentine called? So we are talking about this demarcation between the primary and secondary dentine, and Palak says it's neonatal line. See, what does the neonatal line mean? It means that the tissue separated by neonatal line, let's say this is the neonatal line, right? So whatever tissue has formed before, was formed in the intrauterine life, and whatever tissue forms after is after birth. So basically, neonatal line tells us which tissue has formed in the intrauterine life and which tissue formed after intrauterine life. Now, as far as the differentiation between primary and secondary dentine, the thing is that the neonatal line will be present in the primary dentine, isn't it? It will be present in the primary dentine or primary enamel, since the tooth starts to form within the womb when the baby is within the uterus. Then it starts to form, and when it is born, it is still forming, right? The tooth is still forming. So it will be this neonatal line will be present entirely in the primary dentine, isn't it? Secondary dentine will start to form once the crown is complete or once the root is complete. So when the crown is complete, then secondary dentine will form. So definitely neonatal line will not separate it. Schreger's line, what are Schreger's line? Basically, Schreger's lines are present when the primary curvatures of the dentinal tubules coincide. So let's say here the primary curvatures of the dentinal tubules are coinciding. So there would be a broad dark band and there would be a broad lighter band. So these bands are called Schreger's bands, right? These bands are called Schreger's bands. So just like Hunter-Schreger band in enamel, which are light and dark bands, similarly because of the overlap of primary curvatures of dentinal tubules, these Schreger bands are seen in dentine. And unlike enamel, here we can see only a couple of bands, right? So one in the primary dentine and another one in the secondary dentine, right? So we can have only a couple of bands in dentine, unlike enamel. Now, what is Anderson's lines? Anderson's lines, as we have studied in the class, they are basically weekly growth lines, right? They are weekly incremental lines. So they will be seen at a distance of approximately 20 micron throughout the dentine, isn't it? So now we can say that whatever is left is the correct answer. So what is left here? It is the contour line of Owen, isn't it? It is the contour line of Owen. Contour line of Owen is not an incremental line, isn't it? And originally it was described as a representation of the overlap of secondary curvatures of the dentinal tubule. So we know that during its entire course, right? The dentinal tubule, it shows these smaller vibrations, it shows these smaller curves. And when these curves, they overlap, right? When these smaller curves overlap, it produces contour lines of Owen. And later on we said that any region in the tissue which is produced or which marks an area of hypomineralization, that can also be included under the contour line of Owen. Now here what happens is there is a shift in the direction of dentinal tubule. There is a sudden demarcation. There is a change in the mineral deposition. The secondary dentine is less regular as compared to the primary dentine. The number of dentinal tubules are also less and more irregular, right? So there would be a definite demarcation between primary and secondary dentine, and we have named it contour line of Owen. We have included it under the explanation of contour line of Owen, right? So here the answer is option B, that is contour lines of Owen. Next question, which of the following describes the function of the type 5 collagen in dentine? So type 5 collagen that is present in dentine, what is the function? Now we know that basically there are type 1, type 3 and type 5 collagen fibers which are primarily present in the organic matrix of dentine. So what is the function of type 5 dentine? Option A, it provides tensile strength to the predentine. Option B, it provides scaffold for mineralization. Option C says it supports the structural framework of dentine during the development, and option D says it is responsible for repair. So here what would be the correct answer? Palak, Bhavna, maybe you can try to answer this question. Shailesh. So the correct answer here would be, see, option D is for type 3 collagen. Option A and B, they represent the function of type 1 collagen. So option C is for type 5 collagen, right? Type 5 collagen. So the correct answer is option C, that is, it supports the structural framework of dentin during dentinogenesis or during development. Clear? So during development or during dentinogenesis, it stabilizes the framework of type 1 collagen. Right? It stabilizes the framework. We can say that it stabilizes the framework. Right? Very good, Shailesh. So let's go to the next question. Translucent dentin is commonly found in. So what is the another name of translucent dentin? Translucent dentin is also known as sclerotic dentin, but there is a basic difference between these two terms. And what is that difference? Sclerotic dentin basically represents that the dentin we are talking about is pathologic. It is pathologic, whereas translucent dentin implies that it is physiologic. So apart from being pathologic or physiologic, these two tissues are exactly same, right? So the question is, where is the translucent dentin commonly found? So where is the translucent dentin commonly found? Very good, Shailesh. It is called sclerotic dentin, isn't it? So where are these commonly found? Option A is crown, option B is root, C is proximal walls of the root, and option D is facial wall of the crown. Now the thing is that, see, pathologic dentin or pathologic tissue would more commonly be seen in the crown, isn't it? Because of the chronic caries or because of the chronic trauma, sclerotic dentin may be commonly found in the crown. But the question is not asking about sclerotic dentin. It is asking about translucent dentin. And translucent dentin is commonly found in the root. So if you look at the root, let's say this is the pulp canal, isn't it? This is the canal, and let's say this is the pulp canal. So where will be the translucent dentin found? It will be found on the proximal walls. It is commonly found on the proximal walls, right? It is commonly found on the proximal walls, and in a cross section you might often see this butterfly shaped tissue, right? You might often see this butterfly shaped translucent tissue. So that is the translucent dentin, and hence the correct answer here would be option C, that is proximal walls of the root. Now we do have a option root, right? But option C is more specific, right? Option C is more specific. So it is commonly found on the proximal walls of the root. Clear? आगे बढ़ते हैं. Let's go to next question. Which of the following dental tissue junction does not exist? So which of the following dental tissue junction does not exist? Option 1 is Thank you, Plug Master. Let's go to the next question. So, which of the following dental tissue junction does not exist? Option A is dentino-enamel. So, we know that DEJ, dentino-enamel junction, does exist, isn't it? And it is scalloped in permanent, and it is flat in primary. But significance can be found in forensic dentistry, right? As such, it does not have any significance in the root. In crown, the sclerotic dentin does have a significance. It makes the tissue more resistant to these traumas, to these insults. Like caries attack will be prevented. So the porosity or the permeability of the dentin reduces. So it does have a significance in the crown, but as far as the root is concerned, the significance is only in the forensic dentistry. It can help in estimating the age, right? It can help in age estimation. Here it can help in age estimation. So the DJ is scalloped in permanent and is flat in primary. The cementum pulp junction can be seen at the apex, right? This can be seen at the apex. So option B is also present. Cementodentinal junction is also present. See, cementodentinal junction is exactly opposite of DEJ. The DEJ is scalloped and permanent, but the cementodentinal junction is flat in permanent, but it may be scalloped in primaries. So this you must remember. The cementodentinal junction is exactly opposite of dentinoenamel junction. So obviously, the correct answer of this question would be option D, that is pulp enamel junction. Clear? So translucent dentin helps in age estimation. It helps in age estimation. So the older the tooth, the more the translucent dentin will be present. And not just the translucent not just the proximal surface. If someone asks you where is it more commonly seen, in the cervical third, in the middle third, or at the apical third, the answer would be apical third. So the translucent dentin starts forming close to the apex, right? It starts forming close to the apex. So which of the following statements about hyaline layer of Hopewell-Smith is false? Which is false? We have to find the false statement. Options are cementoblasts are responsible for mineralization. Organic matrix is derived from fibroblasts. The organic matrix is derived from odontoblasts. And option D, dentinal tubules are absent. Right. So which of the statements do you think is incorrect? Which of these statements do you think is incorrect? So which is the hyaline layer of Hopewell-Smith? Let's say this is the root, isn't it? This is the root, and here this is the pulpal space or root canal, right? This is the root canal. So this outermost 20 microns, this outermost 20 microns, this is the hyaline layer of Hopewell-Smith. We have seen that the Tomes granular layer is seen at the subsurface. When we say subsurface, it means 20 microns beneath the surface. And at the surface, what we have is cementum, or outside the surface we have cementum. So cementum is outside the surface, but the surface 20 microns. This is cementum, let's say. And this is cementum. This is hyaline layer, isn't it? So the options are cementoblasts are responsible for mineralization and organic matrix is derived from fibroblasts. The thing is, odontoblasts, they form the organic matrix, isn't it? They form the organic matrix during initial dentinogenesis. They will form the organic matrix, but what will happen? These fibers, collagen fibers surrounding the tooth, what do we call them? We call them dental sac, isn't it? So the dental sac fibers, the fibers of the dental sac, they will reorient, isn't it? They will reorient, and when they reorient, they will interdigitate or they will intermingle with the organic matrix that is laid down by the odontoblast. And where are these fibers derived from? The dental sac fibers, which will in future be called periodontal ligament fibers. So which cells secrete these fibers? Fibroblasts, isn't it? Fibroblasts would have secreted these collagen fibers. So the organic matrix is derived by odontoblasts, and organic matrix is also derived from fibroblasts. And then these odontoblasts, they will release matrix vesicle, isn't it? They will release the matrix vesicle, and this matrix vesicle will lead to mineralization of this entire tissue, isn't it? It will lead to mineralization of this entire tissue. So what will happen? We will have dentinal tubules in this inner half, and that is why we will be able to see Dome's granular layer in this inner half, whereas in the outer half there are no dentinal tubules because that space is occupied by these dental sac fibers. So, do you still think that the option B, the organic matrix is derived from fibroblasts, is incorrect? While the option C, that the organic matrix is derived from odontoblasts, is correct. Do you still feel that these two statements are incorrect? Both of these statements are correct, isn't it? Both of these statements are correct. We are not saying that the organic matrix is exclusively derived by fibroblasts or the organic matrix is exclusively derived from odontoblasts. अगर हम कहते हैं कि exclusively odontoblasts या fibroblasts बना रहा है, तो वो statement गलत होता, right? The statement would have been false if it implied that the entire organic matrix is derived from that particular cell. But these statements, they do not imply any such thing, right? They're just saying that the organic matrix जो है, इसका organic matrix fibroblasts बनाता है, इसका organic matrix odontoblasts भी बनाता है, तो दोनों ही बातें सही हैं, दोनों मिलकर के बनाते हैं, right? Also, dentinal tubules are absent. So all these three statements are correct. Option A, that is cementoblast is responsible for mineralization, this is false. So as we have just seen here, the mineralization is by odontoblasts, isn't it? So this is the correct statement. Option A is the correct answer. So let's go to the next question. Incremental lines of Salter are closely placed in. They are close in which tissue? See, these are incremental lines, isn't it? What do they represent? They represent period of rest, isn't it? So, if the period of rest are close together, if the period of rests are close together as compared to this other tissue, where the period of rest are further apart, isn't it? And each gap represents the work done in one day. Each gap represents what? Work done in one day. So, where do you think the work being done is done faster? Where do you think the work is done faster? ज़्यादा फटाफट काम कहाँ पर हो रहा है? Either option A में या option B में. The gap between these lines represents the work done in a day in both the cases. So, where is more work done in one day? Where is faster work done? तो faster work तो यहाँ पर हो रहा है option B में, isn't it? So basically, in this question, what we are asking is which of these options represents slowly forming cementum, right? Which of these options represents slow forming cementum, right? Which of these options represents slow forming cementum? Is it clear? So options are, please read the question carefully. More than one options may be correct here, right? More than one options may be correct. सिर्फ ऑप्शन डी ही सही हो ऐसा जरूरी नहीं है. ऑप्शन ए बी सी में से कोई और भी सही हो सकता है. प्री फंक्शनल सीमेंटम माइट बी ए सिनोनिम टू समथिंग एल्स, इजंट इट? तो रैपिड सीमेंटम फॉर्मेशन तो कहां पर है और स्लो सीमेंटम फॉर्मेशन कहां पर है? Where is the cementum formed at the slower rate? See, the formation of cementum is opposite to that of dentine. In dentine, primary dentine forms at a rapid rate and secondary dentine forms at a slower rate. But in cementum, primary dentine forms slower and more regular, whereas secondary cementum forms faster but more irregular, right? तो हमें इसमें देखना है कि प्राइमरी सीमेंटम कौन सा है और जहां भी प्राइमरी सीमेंटम है, that is our answer. So D, that is pre-functional cementum, the cementum formed before the tooth erupts or before the tooth comes into occlusion, right? Cementum formed before tooth comes in occlusion. So definitely it is describing the primary cementum or the acellular extrinsic fiber cementum. So option A and option D are exactly same. And option A, obviously, acellular extrinsic fiber cementum has to be the correct answer, isn't it? Option B, acellular intrinsic fiber cementum. There is no such cementum as acellular intrinsic fiber cementum. बहुत पुराना concept है. This highly layer of Hopewell Smith once upon a time in long distant past was confused to be acellular intrinsic fiber cementum. तो इसके ऊपर आजकल कोई क्वेश्चन नहीं आता है, राइट? सो नाउअडेज वी डू नॉट हैव एनी क्वेश्चन ऑन acellular intrinsic fiber cementum, और आपको लिखने की भी जरूरत नहीं है that acellular intrinsic fiber cementum was once upon a time the hyaline layer of Ophiol's Smith. ऐसा कुछ लिखने की जरूरत नहीं है. So option A and option D are both correct, right? So let's go to the next question. Which of the following epithelium has least thickness? Since we are just practicing, right? So that's why I included a question where we can have more than one options correct, isn't it? तो हमें हमेशा अच्छे से ऑप्शंस को स्टडी करना चाहिए, अच्छे से क्वेश्चंस को स्टडी करना चाहिए, राइट? So that we know what exactly it is asking about. Which of the following epithelium has least thickness? So इनमें से कौन सी है जो कि thinnest epithelium है? So we have to find the thinnest epithelium. Option C, junctional. Very good, Pala. Junctional epithelium has a thickness of somewhere around 70 microns to 100 microns. So basically 70 microns is more likely the answer. And floor of the mouth on the other hand is approximately 100 microns. Right? It is 100 microns. Junctional epithelium is slightly thinner than the floor of the mouth. Buccal mucosa has a thickness of somewhere around 500 to 700 microns, where 500 is more likely the answer. And gingiva has a thickness of around 200 microns. Is it clear? So 200 to 250 microns, you can say that. So option C, that is junctional epithelium, is the correct answer. And also, if we replace this question as which of the following epithelium is most permeable, even then the answer would be junctional epithelium, right? So junctional epithelium is highly permeable, highly permeable, the most permeable mucosa, right? It's just that junctional epithelium is not accessible. So for sublingual tablets, for easy absorption, the floor of mouth becomes the main path, right? So most of the tablets, most of the medicine, all those things are absorbed through floor of the mouth, because practically we can say it is the thinnest epithelium and the most permeable, which is practically useful. Unlike junctional epithelium, it is not practically useful, isn't it? We cannot access the junctional epithelium, and yet it is the thinnest and the most permeable epithelium, right? So next question is, junctional epithelium stains positive for which of the following cytokeratins? So it stains positive for which of the following cytokeratins? Options are 10, 16, 19 and 6. So junctional epithelium, first of all, it is a non-keratinized epithelium, and also it represents the reduced enamel epithelium, or you can say odontogenic epithelium. So we need to find a cytokeratin that is common to odontogenic epithelium and non-keratinized epithelium as well, right? And very good, Shailesh and Bhavna. The correct answer is option C, that is 19. Options A, B and C, all these are found in keratinized epithelium or masticatory mucosa. So 1, 6, 10, 16, these are common to masticatory mucosa, right? These are common to masticatory mucosa. Very good. So 19 is found in junctional epithelium. Cytokeratin 19 may also be found in dentigerous cyst, because dentigerous cyst is of odontogenic epithelial origin, right? So any tissue that is of odontogenic epithelial origin, or not any tissue, any lesion that is of the origin of odontogenic epithelium, it will stain positive for cytokeratin 19, right? तो चाहे वो डेंटिजरस सिस्ट हो, चाहे अमीलोब्लास्टोमा भी स्टेन करेगा क्या साइटोकेराटिन 19 के लिए पॉजिटिव. Which of the following is the special sensory innervation for circumvallate papillae? अमीलोब्लास्टोमा भी तो ओडोंटोजेनिक टिश्यू के रेमिनेंट से ही बनता है ना? Yes or no? It is also derived from the remnants of the odontogenic epithelium, isn't it? So options are chorda tympani, glossopharyngeal, vagus and lingual. Which of the following is the special sensory innervation for circumvallate papillae? So let's divide the tongue. into anterior. Very good, Bhavna. Posterior third and posterior most region. So posterior most region is supplied by vagus. Glossopharyngeal supplies the posterior third and chorda tympani supplies the anterior third. And circumvallate papillae, they are located behind the sulcus terminalis. And that's why they will be supplied by glossopharyngeal nerve. Clear? So very good, Shailesh. The correct answer is option B, that is glossopharyngeal. तो शैलेश और भावना दोनों ने ही करेक्ट आंसर दिया है. वेरी गुड. द फास्टेस्ट कंडक्टिंग फाइबर्स इन पल्प आर. सो विच आर द फास्टेस्ट कंडक्टिंग नर्व फाइबर्स इन द पल्प. तो पल्प में फास्टेस्ट कंडक्टिंग नर्व फाइबर्स कौन से होंगे? विच विल बी द फास्टेस्ट कंडक्टिंग नर्व फाइबर्स इन द पल्प. ऑप्शंस आर ए अल्फा, ए बीटा, ए डेल्टा एंड सी. So what is the correct answer here? What is the correct answer here? Now we are not talking about the most common fibers, right? We are talking about the most rapidly conducting fibers. And the correct answer here would be, तो विवेक ने कहा डेल्टा. ABCD आती है ना विवेक? तो हम ऐसे लिख सकते हैं ABCD, या ग्रीक अल्फाबेट्स में लिखिए तो हम ऐसे लिख सकते हैं अल्फा, बीटा, isn't it? No, Bhavna, they are located posterior to sulcus terminalis. Gamma, delta, isn't it? ABCD आती है ना बच्चों, isn't it? ABCD. So जब हम गेम्स भी खेलते हैं या जब हम कोई भी और काम करते हैं, हाउ डू वी रैंक थिंग्स? कॉलेज में, स्कूल में जब रैंक्स भी आती थी तो ग्रेड्स भी ऐसी होती थी, ए ग्रेड, बी ग्रेड, सी ग्रेड, फेल हो गया तो एफ ग्रेड या डी ग्रेड, isn't it? कंपटीशन में जीतते हैं तो भी 1, 2, 3, isn't it? There is a reason for this numbering, isn't it? जो टॉप पे है उसे कभी हम 2 बोल सकते हैं क्या? जो यहां पर खड़ा है, क्या ये विनर है क्या? मतलब ऑब्वियसली एवरीवन इज अ विनर इन लाइफ, बट लेट्स बी प्रैक्टिकल. जो 2 पे खड़ा है क्या वो विनर है? क्या वो विनर हो सकता है? या जो 3 पे खड़ा है वो विनर हो सकता है क्या? आर वी फॉरगेटिंग दिस वन? क्या हम इस वन को भूल जाएं? अभी मैंने तुम्हें एबीसीडी सिखाई. क्या लगता है तुम्हें कौन सा होगा फास्टेस्ट कंडक्टिंग फाइबर इन दी पल्प? विच इज द फास्टेस्ट कंडक्टिंग फाइबर इन दी पल्प? शैलेश और भावना अभी भी ए डेल्टा पे टिके हुए, जबकि मैंने बताया ए डेल्टा तो डी है. डी तो हम जो फेल हो जाते हैं उनके लिए यूज करते हैं, जो पास हो जाते हैं उनके लिए ए यूज करते हैं. ए ग्रेड सुना है कि नहीं कभी? ये ए ग्रेड का समान है, isn't it? जो पैक को लीड करता है वुल्फ पैक होता है. आपने डिस्कवरी देखी होगी, जैसे वुल्फ पैक है उसको लीड कर रहा है वो अल्फा, या कोई लायंस का पैक है उसको कोई लीड कर रहा है अल्फा, है ना? क्यों? क्योंकि ए हो चाहे अल्फा हो चाहे 1 हो, वो सबसे पहले है. 2, 3, 4, 5, 6 को बाद में, अल्फा, बीटा, डेल्टा, गामा ये सब पीछे है. तो सिर्फ एबीसीडी याद रखनी है हमें, ठीक है ना? और फिर से शैलेश का गलत आंसर, क्योंकि हमने यहां पर क्या लिखा था? पल्प. तो पल्प में ए अल्फा नहीं होता, पल्प में ए बीटा, ए डेल्टा और सी फाइबर्स होते हैं. दो ए बीटा आर इन वेरी लो नंबर्स, राइट? दे आर प्रेजेंट इन अ वेरी लो नंबर. So A beta, they are the fastest conducting fiber, though they are very less in number in the pulp. A alpha are absent, though alpha is fastest conducting, isn't it? Alpha is fastest conducting and C is slow. Clear? Is it clear? तो अगर हम स्पीड की बात करें तो 30 to 60 मीटर पर सेकेंड, और सी की कितनी होती है? 0.5 to 2 मीटर पर सेकेंड, isn't it? Type C has a speed of 0.5 to 2 meter per second and beta has a speed of 30 to 60 meter per second, right? Which of the following differentiates the radicular pulp from the coronal pulp? तो ये हमारे पास, let's say this is the pulp, this is the pulp, right? This here is the coronal pulp and here we have radicular pulp, right? So what is the difference between coronal and radicular pulp? Options are collagen fiber bundles, pulp stones, cell-free zone, tall columnar odontoblasts. Right? So which of these will differentiate the radicular pulp from coronal pulp? So we need to find the feature that is स्पेसिफिक टू रेडिकुलर पल्प, बिकॉज कौन सा फीचर है जो कि रेडिकुलर पल्प को डिफरेंशिएट करेगा कोरोनल पल्प से. ठीक है, या आप इस तरीके से भी देख सकते हो, लुक एट दीज ऑप्शंस एंड सी विच ऑफ दीज ऑप्शंस आर प्रेजेंट इन कोरोनल पल्प, विच ऑफ दीज ऑप्शंस आर प्रेजेंट इन रेडिकुलर पल्प. इफ यू फाइंड मोर ऑप्शंस that are specific to radicular, then obviously we are talking about the one which is present in coronal. And if you find more options that are common to coronal, then you will have to go with the option that is common to radicular. तो कोई सा भी पाथ ले लो, आंसर सही आने वाला है. ठीक है, तो collagen fiber bundles, option is collagen fiber bundles. So at one of these places you will have collagen fiber bundles, whereas in the other you will have loose collagen fibrils, isn't it? Pulp stones. Now pulp stones, they are found everywhere. It's just that they are more common in coronal pulp and less common in radicular pulp, isn't it? But then linear calcifications, they are more common in radicular pulp, which is also a type of pulp stone. Third is cell-free zone. Again, cell-free zone is more common in coronal pulp. In radicular pulp, cell-free zones are absent. Then tall columnar odontoblasts, they are also a feature of coronal pulp. In the radicular pulp, the odontoblasts are flat, isn't it? At max, they will be cuboidal, but definitely not columnar and not tall columnar. Clear? So all these three features, they are more specific to coronal pulp. Only option A is specific to radicular pulp, isn't it? So option A is the correct answer. Option A is the correct answer. Is it clear? भावना, शैलेश, विक्की, पलक, क्लियर है ना? ये सब समझ में आ रहा है? And that is why in endodontics you must have studied that while extricating the pulp, you need to engage the radicular pulp and not the coronal pulp. क्योंकि अगर आपने coronal pulp को engage किया तो pulp will tear, right? So to prevent the tearing of pulp, we need to engage the pulp at the root, in the root, right? So which of the following pulpal proteoglycans is associated with collagen stability and tissue repair? Collagen stability and tissue repair. Options are fibronectin. Dermatan sulfate, chondroitin sulfate, and hyaluronic acid. Right? So which of these is associated with collagen stability and tissue repair? तो सबसे पहले तो this is not a proteoglycan, so we can easily rule out option A, proteoglycan, isn't it? Dermatan sulfate, chondroitin sulfate, and hyaluronic acid. So which of these is the correct answer? And the correct answer here would be chondroitin sulfate, right? So chondroitin sulfate helps in the collagen stability and tissue repair. Is it clear? And there is another one, hyaluronic acid. So hyaluronic acid, basically it helps in tissue fluid pressure. It maintains the tissue fluid pressure. Very good, Bhavna. Very good, Shailesh. It's option C, chondroitin sulfate, right? So let's go to the next question. Lactoferrin in saliva is secreted by. तो saliva के बहुत सारे components हैं, various organic, inorganic, isn't it? Inorganic की बात करें तो major, minor ions, sodium, chloride, calcium, bicarbonate, those are the major ions. Then when we go to organic, there are enzymes, there are growth factors, there is immunoglobulin, isn't it? So lactoferrin is one such antibacterial enzyme apart from lysozyme. So lysozyme, lactoferrin, these are the two antibacterial enzymes. So these are secreted in saliva by, options are serous cells, mucous cells, intercalated duct cells and striated duct cells. Serous cells or mucous cells, these are basically the main secretory cells which will produce the saliva or the fluid component of saliva. The mucous cells, they will add mucin, and serous cells, they will add proteins, isn't it? They will add proteins. Salivary modification takes place in striated duct. So when we say modification, what type of modification happens in striated duct? Sodium and chloride are exchanged. These are removed, isn't it? And what is added? Potassium and bicarbonate is added to the saliva. So this is the modification happening in striated duct. Intercalated duct, they also modify saliva by adding, they add lactoferrin and lysozyme. So basically, the intercalated duct, they also have secretory role, isn't it? The intercalated duct also have secretory role. Option C is the correct answer, right? So serous cells, they will add proteins. We know about zymogen granules, isn't it? Zymogen granules are secretory granules which will, or they are transport vesicles which will store the proteins produced by the rough endoplasmic reticulum or the Golgi complex, isn't it? So all the proteins or all the enzymes, amylase, lipase, maltase, all those are stored in those transport vesicles. But as far as these antibacterial enzymes are concerned, they are secreted by intercalated duct cells, right? And not serous cells or mucous cells or striated duct cells. So salivary modification takes place in both intercalated and striated duct, though we do not call the addition of lactoferrin and lysozyme as modification of saliva. So that term modification of saliva is specifically used for striated ducts, right? Where the hypotonic saliva is first produced, isn't it? The initially formed saliva is isotonic. When it passes through striated duct, it becomes hypotonic. तो जो saliva मुंह में आ रहा है, that is hypotonic. जो saliva produce हो रहा है first in the secretory unit, that is isotonic, right? So next is submandibular glands develop from, see, parotid, they develop from ectoderm of the oral cavity, isn't it? The submandibular and sublingual, these develop from the endoderm of the floor of mouth. So they develop from the endoderm, both submandibular and sublingual glands, whereas parotid develops from ectoderm. So parotid to ectodermal derivative है, submandibular or sublingual glands endodermal derivatives हैं, right? So what will be the correct answer here? The correct answer here would be option B, that is endoderm. Is it clear? Option B, endoderm, that is the correct answer in these questions. So if someone asked you, when will these glands start to function, or when will they first produce functional saliva? When will they first produce functional saliva? So functional saliva means the saliva which is equivalent to the saliva that is produced once the child is born, right? So when will the glands first produce functional saliva? They will produce it at 16 weeks of intrauterine life for parotid and submandibular, whereas the first functional saliva is produced at 24 weeks. It is produced at 24 weeks of intrauterine life for sublingual gland, right? So the correct answer here would be endoderm, that is option B. Clear? What is the excretory duct of sublingual gland called? So ये तो easy सा है, and I hope you can answer it without looking at the options, isn't it? You can answer it without looking at the options. What is the excretory duct of sublingual gland called? So excretory duct of sublingual gland क्या बोलते हैं? Either it should be Revenious ducts or it should be Bartholin's duct, isn't it? Stenson's duct or Wharton's duct तो नहीं है. Stenson's duct is for parotid, Wharton's duct is for submandibular. So which of the two, that is option B and C, is the correct answer? So which is the correct answer? Shailesh, Garima, Palak, Vivek. Which is the correct answer? Is it Bartholin's duct or is it Rivenius ducts? Which is the correct answer? चलो let's say even if we didn't know what the correct answer is, right? तो हम थोड़ा सा इंग्लिश तो जानते ही हैं, है ना? तो इंग्लिश के हिसाब से क्या है? Sublingual gland. This is a singular gland, isn't it? It's a singular word. When we say gland, it's a singular gland. Look at these two options. Bartholin's duct. Again, this is a singular duct. Whereas Rivenius ducts, these are plural, isn't it? These are multiple, isn't it? So obviously, multiple ducts cannot be draining a single gland. So option C cannot be the correct answer here. So we are left with just one option. That is Bartholin's duct, isn't it? English. ठीक है, अगर नहीं भी आता इंग्लिश को इस्तेमाल कर लो. सिंगल ग्लैंड, सिंगल एक्सक्रीटरी डक्ट, isn't it? सिंगल ग्लैंड, सिंगल एक्सक्रीटरी डक्ट. ये डक्ट्स लिखा है. डक्ट्स मीन्स मल्टीपल डक्ट्स. सो दे विल बी ड्रेनिंग सबलिंगुअल माइनर सलाइवरी ग्लैंड्स. तो अगर क्वेश्चन में ये होता व्हाट इज द एक्सक्रीटरी डक्ट ऑफ सबलिंगुअल ग्लैंड्स कॉल्ड, तो अगर यहां पर ग्लैंड्स हो जाता, अगर यहीं पर ही क्या हो जाता, sublingual glands, then it would have implied minor salivary glands. नहीं शैलेश, it can't be both B and C. Sublingual gland is drained by Bartholin's duct. This is the sublingual gland and it is surrounded by, or in its vicinity we can see 8 to 30 minor glands. So these minor glands are drained by Rivenius ducts, but this major gland is drained by Bartholin's duct. Clear? तो क्वेश्चन में क्या है? सबलिंगुअल ग्लैंड, it implies major salivary gland. अगर इसकी जगह सबलिंगुअल ग्लैंड्स होता तो it would have implied minor salivary glands, या क्लस्टर ऑफ सबलिंगुअल ग्लैंड होता या ग्रुप ऑफ सबलिंगुअल ग्लैंड होता तो भी वो ये सब कुछ इंप्लाई करता. अगर ग्रुप होता तो उसमें दोनों आ जाते एंड देन ऑप्शन बी एंड सी बोथ वुड हैव बीन करेक्ट. तो हो सकता है इसमें इस तरीके से पूछ लें कि ग्रुप को कौन सप्लाई, ग्रुप को कौन ड्रेन करता है, तो आप ऑप्शन बी और सी दोनों मार्क करोगे, राइट? बट इफ इट इज जस्ट सबलिंगुअल ग्लैंड देन इट इज Bartholin's. If it is sublingual glands then it is Rivenius ducts. Is it clear? So absence of which of the following growth factors will result in inhibition of tooth development at the bud stage? तो ये bud था, यहां से cap बनना था, but this got inhibited. So absence of which of these factors will inhibit the development of bud into a cap stage? तो एक तो क्या होता है कि at the end of bud stage, the primary enamel knot appears, isn't it? The primary enamel knot appears. Right? Primary enamel knot appears. So, primary enamel knot, it inhibits the proliferation of cell at this local point, resulting in the cap shape. तो morphodifferentiation, histodifferentiation सब कुछ at the end of bud stage शुरू होता है, जो कि हमें दिखता है cap stage, right? Apart from this, there are two growth factors which are responsible for this transition, and they are PAX9 and MSX1. So if either of these two is absent or if either of these two is missing, even then the bud will not transition into cap. So if primary enamel knot is missing, if PAX9 is missing, if MSX1 is missing, if either of these three is missing, the bud will not transition into cap stage. Is it clear? Very good, Shailesh. The correct answer is MSX1, right? MSX1. Also remember that SHH and WNT, these are both proliferative, right? And BMP2 is inhibitory. MSX1 is also anterior teeth specific. That is, it is expressed in the regions of incisors and canines, though it overlaps in the premolar region, right? It is anterior specific. Clear? So let's go to the last question of today's class. The first evidence of tooth formation is seen at. First evidence of tooth formation. Now it is not first histological evidence or first morphologic evidence or first radiographic evidence or first molecular evidence. It is simply first evidence of tooth formation. So what do you mean by first evidence of tooth formation? First evidence of tooth formation implies establishment of primary epithelial band, right? Establishment of primary epithelial band. So when does the primary epithelial band establish? When does it start to proliferate? When does it establish? It starts to proliferate at 11th day of intrauterine life, right? It starts to proliferate at 11th day of intrauterine life. And when does it complete? When does it complete? It completes at 6th week of intrauterine life. Isn't it? It completes at 6th week of intrauterine life. तो अब बताओ क्या आंसर होगा? I have given you the answer here. You just have to tell me which of these options is the correct answer. So which of these options should I mark? I should go with 37th day of intrauterine life. Isn't it? 37th day, 6th week. Isn't it? So whether you say 6th week or whether you say 37th day, it's one and the same thing. 37th day is more specific as compared to the 6th week. Isn't it? So let's say if I had another option and maybe that was 6th week of intrauterine life, we would still go with 37th day of intrauterine life. Isn't it? We would still go with intrauterine life. With dental lamina, it is established by 8th week. Right? Dental lamina is established by 8th week, and we are not talking about dental lamina, we are talking about epithelial band. See, this epithelial band, when it is completely fully established at the 6th week, it will proliferate vertically. Let's say this is the epithelial band, right? So initially what happens is these cells, they proliferate in horizontal plane, and thus the primary epithelial band is established from 11th day to the 37th day. Once the primary epithelial band is complete, let's take a cross section, right? So let's say this is the epithelial band. This epithelial band, it will proliferate in the vertical direction. So there is no increase in the mitosis. There is just a change in the direction of mitosis. So when this direction of mitosis changes, it will proliferate into two bands, a lingual and a buccal. So this buccal band, this is called the vestibular lamina. And this lingual band is called dental lamina. So first the epithelial band needs to be established. Only then it will proliferate. Only then it will divide into dental lamina and vestibular lamina. So dental lamina or vestibular lamina, they are established by 8th week. Right? They are established by 8th week. Is it clear? Vivek, is there any other doubt? Do you guys have any other doubt? Because I had just these 20 questions and we are done for today. So do you have any other doubt? अगर कोई डाउट नहीं है तो फिर हम कल मिलेंगे कुछ डीए के क्वेश्चंस के साथ, राइट? So I guess you do not have any doubts, and if you do, then please ask them. तो फिर क्लास ओवर करते हैं, ठीक है, अगर कोई डाउट नहीं है तो।